that I chose to do for week 2 was from chapter 3 called The Mogabgab vs. Orleans Parish School. The parties involved in this case, the plaintiffs were Joy Mogabgab, who was Robert's mother, and William Mogabgab, who was Robert's father. The defendants in this case were the Orleans Parish School Board, Robert O'Neill, who was the head football coach, Sam Mondello, who was the assistant football coach, the Estel Barkemeyer, the principal of Orleans Parish School, Carl Doles, who was the superintendent of Orleans Parish School Board, and then Jack Pisano, who was the supervisor of Health, Safety, and Education Division of Instruction of Orleans Parish School. So what was this case about? This case was about a 16-year-old high school student who was participating in football practice on the second day of the season. The coaches had the athletes participating in wind sprints when Robert suddenly felt fatigued and displayed signs that he was tired. He had collapsed. Robert collapsed at practice. He was still conscious at the time, but he wasn't able to walk himself to the bus to go back to the high school. So 2 of Robert's teammates escorted him to the bus, where he began feeling nauseated and vomited before getting on the bus. Once he was on the bus, one of his teammates claimed that Robert was losing himself, and he still displayed signs of being fatigued. Once they got back to the school, Robert was placed on a blanket on the cafeteria floor where he was undressed, the coaches were preparing him to take a shower. So about 30 minutes after Robert had collapsed, he was placed in the shower and placed back on a blanket in the cafeteria and was provided an ammonia capsule by Coach Mondello. Robert's condition at that time, he was clammy, pale, he was breathing really heavily. The head coach, Coach O'Neill, was in his office for the majority of the time, while Coach Mondello was kind of going through first aid books, trying to figure out signs and symptoms that Robert was displaying to try and help him. Teammates, parents observed Robert on the cafeteria floor and expressed their concerns, in the condition that Robert was in, that medical personnel should be summoned at that time. When the teammates' parents observed Robert, his conditions had worsened and he was grayish. He had grayish-blue skin. He was making moaning sounds. And the teammate's father, insisted that Coach Mondello someone call medical personnel, but Coach Mondello stated no. If a doctor is going to come, it's going to be, a doctor that we know that lives close in the neighborhood, that could be here quickly, and is also on the school board. Robert's parents were contacted at roughly an hour and 20 minutes after their son had collapsed at practice. When Robert's parents got there, they summoned Robert's physician, and he arrived roughly about 2 hours after Robert had collapsed. And when Robert's physician got there, Robert's condition had worsened severely, and at that point Robert was unconscious. He was clammy, profusely sweating, and really had no responsiveness to light. And at that time, the physician had diagnosed Robert with profound heat exhaustion and stroke. Robert was taken to a medical center where he was in a coma and passed away at 2:30 a.m. So the arguments on this case, the plaintiffs, filed the suit for the damages that they incurred for the loss of their son. They felt that the defendants failed to perform their duty of providing necessary and reasonable safeguard to prevent accidents, injuries, and sickness of athletes, and then that they also failed to provide for prompt treatment when injuries and the sickness occurred. The defendants denied allegations of negligence. They pled that the contributory negligence of the plaintiffs in allowing their son to participate in football and assumed the risk when he started that participation, and the parents previously knowing that Robert had increases in blood pressure and abnormal heart rhythms. So what the court findings was Coach O'Neill and Coach Mondello actively denied Robert's access to treatment after symptoms had appeared. So by the time that physicians were contacted that Robert had medical attention, at that point the symptoms were too severe that they could not be reversed at that time. The lower court dismissed the plaintiff's suit against the principal of the school and the superintendent of the school and the supervisor of health, safety, and physical education of the Division of Instruction of Orleans Parish School. However, the judgment rendered in favor of the plaintiffs for $20,000 for the mother of Robert and $21,634.75 for Robert's father. So after reading this case, some things that athletic administrators, want to make sure of and want to do to prevent cases like this is, be sure that coaches have a up-to-date CPR, AED, first aid certification, and not only, having them obtain this certification, but also educating and training the coaches on procedures and having athletes transition into physical activity and how to transition into heat conditions, especially being at the beginning of the season. Another option too is have athletic trainers on site. Depending on the size of the school, some schools always have athletic trainers at practice. Others have athletic trainers that can travel from practice to practice with different practices going on. But if you don't have an athletic trainer, have information of an athletic trainer who can be readily available, who can be contacted when injuries and illnesses like this occur. Another big important part is to have an emergency action plan in place. So the school may have had an emergency action plan, but since the practice occurred off-site of the school, it'd be really important to make sure that an emergency action plan was put in place for that practice facility that they were at in order for the coaches to follow certain protocols and procedures in dealing with an illness off of school property. Lastly, follow up with the teammates and families and friends that were affected, that could be affected by a loss of a student or a friend or a family member, and reach out to them and have a procedure set in place